we're going to discuss image acquisition for basic cardiac views. So starting with the parasternal long, the cardiac views are a little unique because the indicator, if you look on the screen, is actually on the right side of the screen, whereas almost every modality otherwise is on the left of the screen here. So with the cardiac parasternal long, you go in the long axis, oblique, with the indicator on the probe towards the patient's right shoulder. So usually you start kind of big sweeps until you start to see some cardiac motion, and then you localize in. There you go. So there's the parasternal long axis. There you can see the left ventricle here. There's the left atria, mitral valve, slapping 5 with the septum, left ventricle, and then the outflow. So it kind of goes swoosh up here and then out. And on top is the right ventricle there. From that standpoint, then you move to the parasternal short. So I'm moving about 90 degrees or 45 degrees to the patient's left shoulder with the indicator there. And you usually want to find a donut view, fish mouth view, they say, with the mitral valve right in the center of the screen. And so you want to picture that left ventricle squeezing to an imaginary point right in the center. You can see the right ventricle on the outside here. Then the third view you'd like to try is the apical view. So you slide down, it's usually a little medial and inferior to the left nipple, and you try to sit right on top of the rib. And so we'll try to get a 4-chamber view. So there's a decent 4-chamber view. See the septum in the middle. I'm sitting right on top of the rib with constant pressure. You can see both valves. You can see an overall large view of the 4 chambers of the heart. If you're struggling with this view, then you can have the patient roll on their left-hand side. And sometimes it gives you a different angle to come and sit right on the rib and angle towards the sternum. And so that's another approach. You can adjust your depth as well, depending. So it's another way. The last view is the subxiphoid view. So we have the patient roll back on their back, and then the indicator is towards the patient's left side. And then you kind of hold pressure subxiphoid. If you're struggling with the view, adjust your depth. You're going through liver and more tissue typically. And then on the screen here, take a breath and hold it, please. Good. And you could see the right ventricle right near the liver, the left ventricle, and then the corresponding atria below. You would see dependent pericardial effusion in this view would be down inferiorly. You can breathe. Those are your 4 basic views of the heart.